Dr. Menard, thank you very much for joining us here again on Health Connection. Topic is vaccination. Our premise is you're never too old to be vaccinated. So let me ask you the first question. Other than the obvious, the flu shot, what other vaccinations should adults be concerning themselves with?
Yeah, there's a certain number of vaccinations, Paul, that people are recommended to get as adults. And fortunately, they're not nearly as many as in childhood. We can all remember the numerous childhood vaccinations that we had. But the ones that readily come to mind, the pneumonia vaccine, shingles vaccination, and then your Tdap, which is your tetanus, diphtheria, and pertussis boosters. So.
Well, since you brought it up, talk about the Tdap, which stands for, say it again, diphtheria, tetanus, and pertussis.
Correct. The Tdap stands for tetanus, diphtheria, and pertussis.
What does it do? Why do we need it? And are there side effects?
Okay. They protect against those three illnesses. Typically, you get a series of these vaccinations in childhood. The pertussis we give one time as an adult. So the typical vaccination you're going to get every 10 years as an adult has the tetanus and diphtheria components to it. One time in your adulthood, if you don't get it in your teenage years, you will get it as an adult. But the typical boosting is every 10 years. One of the exceptions would be pregnant women. With every pregnancy, they do get the Tdap vaccination.
Mm-hmm. Pneumococcal vaccine, is that the same as the pneumonia vaccine?
It is. The common name for it is called Pneumovax. It protects against the most common agent that causes pneumonia, the pneumococcus. Of course, there's hundreds of bacteria, viruses that do cause pneumonia. This one helps to reduce your chances of getting pneumonia, particularly with older adults. We do give that as a one-time vaccination once you reach the age of 65. However, individuals that do have a number of chronic illnesses, such as pulmonary infections, cardiac disease, kidney disease, immune problems such as HIV, we will go ahead and give that earlier than age 65, perhaps with a second dose as a booster as well. So.
You pretty much answered this, but let me just ask it a little bit differently. Why should adults get a pneumococcal vaccine, and does it really work?
It does work. There is a form of it that's given to children under a different name, Prevnar, that the studies are showing it may actually give some greater benefit to the adults in addition to the normal adult vaccination that we give. Again, it does reduce the rate of getting that most common form of pneumonia, which is pneumococcal pneumonia, particularly with people that have chronic lung disease like COPD, emphysema, asthma.
Another vaccine. We probably all know somebody who's had a very, very painful case of the shingles. So let's talk about who, what, and when of the shingles vaccine.
Okay. Shingles is basically the adult form of chickenpox, and anyone that's over the age of 30 can certainly remember getting chickenpox as a young kid. Now there's vaccinations in childhood that we give to help prevent or cool down the chickenpox infections that we all remember. For those people that have had chickenpox, shingles is basically the adult form of the disease that lies dormant in our nerve cells, and it can come back with a fury, cause chronic nerve pain, a terrible rash. Depending where it's located, if it's in your eye or ear, it can cause permanent damage. And so the shingles vaccine is approved for individuals 50 and over. Most insurances will pay for it once you reach the age of 60. A big issue that we are dealing with is that Medicare does not cover the shingles vaccine. So oftentimes, individuals that have secondary insurance coverage can get it. But, it can often be a challenge, and that's why some people opt not to get it. But generally, we encourage them to go ahead and get it because it is recommended.
How effective is it?
very effective, and a lot of the studies are showing that it does reduce your risk of getting it even if you've had the shingles before. Like most vaccines, it will ramp up your immune system to help fight it off should you have some sort of illness that weakens your immune system, which may make you more likely to get shingles again. So.
Another vaccine, MMR. Why do adults born after the year 1957 need to be concerned with it?
Okay. MMR protects against 3 illnesses, measles, mumps, rubella. Much older adults, 65 and older, may remember this way back when this was a common childhood rash, all 3 of these. And some of them, especially measles, can cause devastating illness to kids. There's some research showing that even though it's given in childhood, adults, particularly those that travel and work in healthcare, may need some extra immunity. And so now it's recommended that certain individuals do get a booster shot, maybe even 2, into adulthood.
So let's say you ignore all of this. How serious are the risks for adults who don't get the flu, Tdap, shingles, pneumococcal vaccines? What risk are they running?
Well, certainly with the pneumonia, the pneumovax, you risk getting that most common form of pneumonia, particularly the individuals with lung illnesses, with chronic kidney disease and whatnot. It can cause devastating illness, perhaps death if you're hospitalized. Certainly the tetanus, everyone knew that commonly as lockjaw, but it would cause these awful contractions of your muscles that would last weeks to months, and extreme pain. Oftentimes individuals were bedridden. The measles rash certainly would cause not only the rash, but pulmonary illnesses, cardiac problems, all sorts of illnesses associated with that. The shingles, which we alluded to, can cause an awful chronic nerve type pain, which certainly will make life a challenge for especially older individuals.
Are there any other vaccinations for adults that we need to know about?
There are certain ones in special cases, such as your hepatitis A and B vaccinations. Often those are recommended for people who do travel, who do work in the healthcare environment. Other ones that come to mind, yellow fever, certainly for travels. A lot of those are typically special instances, and usually when discussed with your doctor, those special cases we can address.
Let me throw one at you here. There's the internet is a good thing or a bad thing depending on what you do with it, but there's an awful lot of folklore, mythology, call it what you will, on the internet, that vaccines cause problems, that they're dangerous, that with respect to children, they can bring about autism. Can we deal with the risk-benefit analysis of vaccines versus not being vaccinated?
Yes, and there was a huge, maybe 10 years ago or so, huge controversy with whether vaccinations do cause autism. That study was never successfully repeated, and actually was sort of put to rest. And when you consider what these illnesses did in the past before the vaccinations, typically the illnesses were much worse than the small amount of risk you might get by taking these vaccinations.
Are we not victims of our own success? We've so successfully immunized the population that we can imagine now that we don't need to be immunized.
Absolutely not. For a time, there's a phenomenon called herd immunity, where a whole population of people may not be exposed to an illness, but if it somehow gets back into the population, it can cause recurrent epidemics. We're starting to hear about the resurgence of pertussis and measles around various places in the country. So it's still very important to get our vaccinations.
The reality is we still need to be vaccinated.
Absolutely.
Are there any new vaccines on the horizon?
There are some that we are currently giving and will be giving in the future. One that I forgot to mention was the HPV vaccination, which protects against human papillomavirus that does increase the risk for cervical cancer in women. That one in particularly, we're now giving to young men as well. The reason I didn't mention is because usually it's a adolescence vaccination, but now adults do have an indication for it if they weren't vaccinated in childhood.
Mm-hmm.
It is an example of a vaccination that does prevent an illness that does cause cancer. Certainly, there's a lot of buzz on that particular topic. Are there vaccinations coming out that may be able to prevent or cure cancer in the future? Some of those are out on the horizon. There's also there's a vaccination against tuberculosis that has been used and present in Europe and many third world countries for years now. We don't use it in the U.S. There's some research ongoing to see if perhaps there could be development of a better vaccine against tuberculosis. Those are some of the new hot item topics in regards to vaccinations.
Very well.
As we go forward.
Doctor, thank you very much for your time.
All right. Thank you very much, Paul.